Namaste. I'm Dr. Anusha, consultant neurologist at Apollo Speciality Hospitals, OMR. On the event of the World Stroke Day, I'm going to share a few points about stroke. Stroke is a neurological emergency. As you all know, patients may develop sudden onset of weakness of the face or their hands, or sudden incoordination, or sudden difficulty in talking, or loss of consciousness, or they may have sudden balance issues. So, any patient who has sudden onset of any neurological symptoms has to be considered to have a stroke and brought to the hospital immediately. So, there are two types of stroke. One stroke is where there is a blood clot in one of the blood vessels of the brain, and it causes some changes in the brain because of lack of circulation to that part of the brain. This is called as an ischemic stroke. Another stroke is what we call as a hemorrhagic stroke, where there's bleeding inside the brain. Either way, both patients need emergency hospitalization and acute care management. Problem with acute ischemic stroke, wherein there is a blood clot in the brain, is the emergency management. If the patient is brought to the hospital immediately within 4.5 hours after excluding an hemorrhage, there is scope to reverse the stroke by giving certain injections which can act as clot busting agents and potentially improve the stroke symptoms. In some cases, if there are large vessel clots, they can be removed by a procedure called as mechanical thrombectomy. They also have potential to improve provided timely management is done. In other cases who come as a delayed presentation to the hospital, management will be focused on treating the acute complications of the stroke and improving the stroke symptoms by providing neurorehabilitation. In case of hemorrhagic strokes, the acute management may also entail surgery in certain cases when there is a compression of the brain tissue and vital structures because of the bleeding inside the brain. So, if you look at the acute ischemic strokes, which are caused due to clots in the blood vessels in the brain, there are many risk factors which everybody is aware of, and I will update you about it. The common risk factors are heart diseases, diabetes mellitus, hypertension, that is high BP, high cholesterol levels, sedentary lifestyle. Certain genetic factors can also cause strokes. Despite emergency management, some strokes patients will continue to worsen in the initial few days, and most stroke patients will need to remain in the hospital for extended periods of time depending upon the nature of their stroke. So the important point is that stroke, if identified early and brought to the hospital on time, we have advanced medications which can be given within the target window period to reverse the strokes.